welcome back guys. Now let's continue with diabetes insipidus and SIADH. These two conditions are the disorders of the antidiuretic hormone. Now let's look at the diabetes insipidus. Now, what is the meaning of the word diabetes? Most of the students will think diabetics mean there is a lot of glucose in the blood. Now, the word diabetic literally means more urination. Diabetes means more urination. So, whom you have to call a diabetic? The person who is going for urine again and again. Okay, for every half an hour, every 45 minutes, the person who is going for the urine again and again, you can call them as a diabetic. That's the exact meaning. Then what is the meaning of the word insipid? Insipid meaning tasteless. The urine that he is producing is tasteless. That's the literal meaning, guys. So, tasteless urine. Okay, you might be wondering who is going to taste the urine, right? Tasteless urine. Tasteless urine. Now, based on this, tell me, what exactly is the meaning of the word diabetes mellitus, which is totally different disorder. Diabetes again means he is producing more urine, and the urine that he is producing is milli. Milli means sweet. So, sweet urine, that's the literal meaning. So, previously, this is how the diagnosis is made. Okay, by tasting the urine. So, if the urine is sweet, then the person is diagnosed as diabetes mellitus. Now, diabetes insipidus means the urine that he is producing is tasteless. Why there is no taste, I will explain. So, what is the pathophysiology of diabetes insipidus? See, there are two possibilities. Possibility number one, there is no antidiuretic hormone. Okay, no antidiuretic hormone. First of all, there is some damage to the central nervous system, or hypothalamus is damaged, or posterior pituitary is damaged. So that no antidiuretic hormone, or antidiuretic hormone is there, but receptor is mutated. So either there is no antidiuretic hormone, or either this receptor is mutated. So tell me, in both the conditions, do you think the aquaporin 2 channels are produced? The aquaporin 2 channels, guys? No, there is no aquaporin 2. Without aquaporin 2, do you think this water will be reabsorbed? No, water is not getting reabsorbed. Where do you think this water will go? Water will go into the urine. Now, my question to you, there will be more urine production or less urine production? More urine, sir. So, he is producing more and more urine. So, that's why we are using the word diabetic. So, he is diabetic. He is producing more and more urine. Now, tell me, whenever you are keeping more water into the urine, you are adding more and more water into the urine. When you add more and more water into the urine will be concentrated or diluted? The diluted urine. So, this urine is going to be diluted. Or you can say hypoosmolar. Okay, urine is going to be hypoosmolar. Means diluted, no, diluted means hypoosmolar. Now, let me give you a condition. Imagine you are having Coca-Cola. Okay, you went to a party where you got Coca-Cola or some kind of a soft drink. Now, you are getting only a little bit of cola. Okay, you got only a little bit of cola, but you want to make it look full. So, what you have to do, what you are doing is you are going to add some water to it. So, you got only a little bit of cola, you want to look it full. So, what you have to do? You have to add water to it. You are adding water to it. So, now when you are adding water to it, so tell me what will happen to the volume? The volume is going to increase. But what will happen to the taste of the cola? The taste of the cola is going to go down, right? So, when you dilute the things, okay, when you dilute the things, what will happen to the taste? Taste will decrease. So, now you understand? So, as you are adding a lot of water, into the urine will become diluted. So, diluted things will lose the taste. So, tasteless here, literally meaning tasteless meaning diluted urine. Okay. So, because of this diluted urine, the word that I am using is insipidus. Okay, diabetes insipidus. Diabetes meaning he is producing more urine, and that urine he is producing is diluted urine. Now, tell me, how many types of diabetes are there, sir? Diabetes insipidus are there. See, two possibilities I have told you. Either there is no ADH, that is called as the central diabetes insipidus, maybe due to damage to pituitary gland or hypothalamus, means some problem within the central nervous system, or antidiuretic hormone is there, but the V2 receptor got resistant, V2 receptor resistance. That is called as a nephrogenic DI, means problem within the kidney, nephrogenic diabetes insipidus or central diabetes insipidus. Now tell me, in which people do you think the V2 receptor can undergo damage or resistance? Causes include lithium, amphotericin B and amyloidosis. So in these conditions like lithium, amphotericin B and amyloidosis, in these conditions the V2 receptor may not function. Okay, V2 receptor may not function. Done. So what are the drugs that we have to use for the treatment of these conditions? You think logically and tell me. In central diabetes insipidus, what is the treatment that we are doing? We are going to give a drug called as a desmopressin, guys. Why desmopressin? See, desmopressin, I have told you, it will stimulate which receptors? V2 receptors. It's going to stimulate the V2 receptors. When the V2 receptors are stimulated, no problem. Problem solved. So, how we are treating central diabetes insipidus is by giving a drug called as a desmopressin. Desmopressin will go and stimulate the V2 receptors. And once the V2 receptors are stimulated, problem solved. Again, the aquaporin 2 channels are produced and water reabsorption occurs as usual. But treatment for nephrogenic DA is little different. Here we are not using desmopressin because in nephrogenic the problem is with the V2 receptors. So antidiuretic hormone or desmopressin cannot work in this condition. So the drugs which we are using in this condition are thiazide diuretics. Okay, thiazide diuretics. So thiazide diuretics, indomethacin can be used. So the treatment is different. Central DI, desmopressin. Nephrogenic DI, thiazide diuretics. And if you look at the labs, how the lab values will be? Tell me, just now I have explained you. What about the urine? How the urine will be? The urine will be having hypoosmolar, which means diluted urine. Then what about the plasma? Okay, plasma will be hypertonic. Okay, hypertonic plasma. The plasma is going to be hypertonic plasma. Why hypertonic plasma? Because the person is losing the fluids out of the body. When the person is losing the fluids out of the body, the plasma will become concentrated, the urine will become diluted. Exactly opposite. Done. Now, let's see what exactly is this SIADH. Exactly opposite. Exact opposite to the DA, diabetes insipidus. What is the full form of SIADH? Syndrome of inappropriate ADH synthesis. Syndrome of inappropriate antidiuretic hormone synthesis. You can remember it like syndrome of increased ADH. Okay, syndrome of increased ADH means the syndrome where antidiuretic hormone is increased. Why? Why there is more antidiuretic hormone is because of a cancer. Let's say this person is having a cancer. Which cancer? Lung cancer. Now, this lung cancer called as a small cell carcinoma of the lung or oat cell carcinoma of the lung. So, this lung cancer unnecessarily, see, it is producing lots of antidiuretic hormone. Today, there is lot of antidiuretic hormone. Lots and lots of antidiuretic hormone. Now tell me, this antidiuretic hormone, what it is doing? It is stimulating the V2 receptor. It is stimulating this V2 receptor. Now, when this V2 receptor is stimulated, when the V2 receptor is stimulated, there is more water reabsorption. More aquaporin 2 channels, more water reabsorption. So today, tell me what happened to the water reabsorption? More water reabsorption. So, when more and more water is getting reabsorbed in the body, what do you think will happen to the urine that is getting produced? More urine production or less urine production? There is less urine production. Okay, less urine is getting produced. And how this urine will be? The urine will be diluted or concentrated? It will be definitely concentrated urine. So, if you look at the laboratories, lab values, the urine will be concentrated. The urine osmolarity is more. It's like more concentrated urine, But what about the plasma? Exactly opposite. The plasma is getting diluted. Because where do you think all this water will go? All the water is going back into the body. All the water goes back into the body, making the plasma diluted away, making the sodium levels in the plasma diluted away. You understand, right? So tell me, where all this water is going? Going back into the plasma, going back into the body, reabsorbed back into the body. So what will happen to the plasma? Plasma is diluted. The sodium levels in the plasma diluted. So there will be dilutional. As you are adding more and more water into the plasma, there will be dilutional hyponatremia. The sodium levels will be diluted, chloride levels will be diluted. Okay. So now if they ask you dilutional hyponatremia is seen in SIADH, where the urine is concentrated but the plasma is diluted. Okay. Now tell me, this SIADH is seen in which cancers? It is associated with conditions called as a oat cell carcinoma of the lung, or small, also called as small cell carcinoma of lung. Okay, small cell carcinoma of the lung. It is also associated with the carcinoid syndrome, other conditions also. But main thing is more antidiuretic hormone is there, so more water reabsorption, less urine production, concentrated urine, diluted plasma, dilutional hyponatremia is going to be seen. Now, how to do this investigation? See, there is a investigation of choice. What is the investigation of choice? Normally, let me tell you, what is normal? Whenever the person is dehydrated, look, which hormone is produced in the body? Antidiuretic hormone is produced. Okay, in a dehydrated patient, antidiuretic hormone is produced. Everyone knows in dehydration there is production of antidiuretic hormone. But when you give water to this patient, if you ask the patient to drink more water, okay, you are hydrating the person, you are asking the person to drink more water. When you give water, what will happen to the ADH levels? The ADH levels will decrease. In dehydrated patients, ADH levels will be more. But whenever you ask the patient to drink water, okay, he is drinking 1 liter of water, let's say, immediately what will happen to the antidiuretic hormone? In a normal individual, ADH levels will decrease. So upon hydration, ADH levels will decrease, so that he will lose the water in the form of urine. Simple logic, right? See, when you drink 1 liter of water, you will produce more urine. We don't want antidiuretic hormone then. Now tell me, to this patient who is suffering with SIADH, in a patient who is suffering with SIADH, I am giving him water, I am loading him with water, I am giving him lot of water, let's say I am asking him to drink 1 liter of water. But even after drinking this 1 liter of water, do you think ADH levels will go down? No. The ADH levels in this person will still be high. The ADH levels will still be high. Why? Because the ADH is coming from the cancer. This cancer is not responding to anything. Continuously, it is producing the ADH. So, even after water loading, the ADH levels are still high. They are not going down. So, that is the investigation of choice. Now, tell me how to treat this condition. So, the treatment of this condition is to block this receptor. Okay, we can't treat this cancer that easily. So, what we can do, we can at least block this V2 receptor. So, treatment is V2 receptor blockers. What are they? Drugs called as tolvaptan, conivaptan. Okay, tolvaptan, conivaptan. These are the V2 receptor blockers which can be used in the treatment of SIADH. So, as a recap, I am telling you, diabetes insipidus. There are two types of diabetes insipidus. Central, nephrogenic. Central is treated with desmopressin. Nephrogenic is treated with thiazide-diuretics. SIADH is treated with V2 receptor blockers called as vaptons. Next up, for esophageal varices, what we have used? Terlipressin. For von Willebrand disease, what we have used? Desmopressin. Okay. So, with this successfully, what we have completed? We have completed the topic of collecting duct also. We have seen how aldosterone, okay, how aldosterone is acting on the collecting ducts. The two abnormalities of the aldosterone, that's the Conn syndrome and Liddle syndrome we have seen. Okay, where aldosterone levels will be decreased, Liddle syndrome. Where aldosterone levels will be increased, Conn syndrome. In the same way, where the antidiuretic hormone levels will be increased, ADH levels more, that is SIADH. Where the ADH levels will be less, ADH levels are going to be less in diabetes insipidus. That's the central diabetes insipidus. So, with this successfully, we have completed the topic of diabetes insipidus and SIADH, and collecting ducts topic is completed. So, in the next video, we'll be discussing about acid-base balance. Hope the video is helpful. Thank you.